We're back with Dr. Brad from Summit Family Dental, and the question today is just all about veneers. What are veneers?
So veneers, Randy, there's a couple different types of veneers, but mainly it's an aesthetic process to veneer or cover a tooth, and mainly it's to mask a deficiency, or if there's some people who will opt for veneers instead of going through orthodontics, because you can instantly straighten teeth and change the smile line. You can change colors, you can change contrast, you can change the overall appearance of a person's smile very quickly with veneers. So there's two ways to do that. You can do a porcelain veneer, which the plus side of a porcelain veneer is they're bonded. They're very, very strong. Longevity, there's a good lifespan for porcelain veneers. The cost is a little more than if you went the other route, which is composite veneers, and that's basically a filling material. Most people are familiar with fillings, and composite veneers would be a composite filling that covers or masks, the tooth's imperfection. Or if you want to whiten your teeth and use a bright white type of composite, we could do that as well. But that's the long and short of veneers. The big thing is it's an aesthetic. It's the goal of veneers is to improve the smile and make teeth look a lot nicer.
And in terms of which one is best for anybody, it's just best if they contact you and explain their concerns and get your opinion on what they need.
Right. Different people have different goals, but we're more than happy to sit down with you and explain the nuances and the ins and outs of each process, and which veneer is better, or what might be better suited for each individual patient. Sure.
And I'll tell you, could you tell the folks right now what happens during that procedure? What can be expected when they get in the chair?
You're saying for the consult appointment or for the veneer appointment?
Well, actually getting the veneers put on.
Yeah, so if you're doing the lab fabricated veneers, generally there will be some anesthetic involved. We get the patient numb, and then we'll take away some of the tooth so that we have a thickness to make the veneer, the porcelain, a certain thickness so it looks nice. And then we'll take an impression of that tooth in either digital or analog with some putty, and that will go off to the lab, and the lab will make or fabricate the veneers. And in the meantime, you'll have a temporary veneer that covers the tooth, and we'll bring it back later, generally a couple weeks, take the temporaries off and glue or cement the new veneers on. If you're doing composite veneers, that's generally a one stop, one visit. You come in, we prepare the tooth, and we bond everything on at that appointment, and you leave that day with the veneers on.
Well, if you've been thinking about brightening up your smile and you think veneers may help you, what you got to do first of all is talk to the folks at Summit Family Dental. You can stop by the website right now and get a little more information. Go to summitsmilesiowa.com, and then if need be, give these guys a call, and they can talk you through the process and help you arrive at the right type of veneer you may need, and they know what they're doing too. So you're not going to have anybody better to be hovering over you when you're in the chair. So, Dr. Brad, thank you very much for joining us again today.
Thanks, Randy.
Take care.